Hi, Aim. How you doing?
Good, Mayor. How are you?
Well, thanks for joining me today. So just a little bit about myself. I'm Marianne. I'm the founder and owner of Bloom Cherry Wellness, and Amy is a good friend of mine, a nurse practitioner, and she introduced me to the X39 stem cell patches. And I'm really excited about this technology and how it's helping people, and wanted to just talk a little bit today about how you came about to find these patches and like how it's helped you thus far. If you can just give us a little, journey.
Sure, sure. So I was actually introduced to the patches initially by my functional medicine doctor. Um, just a little background about me. So I've been a nurse practitioner for 25 years. And after I got my COVID vaccine, I was diagnosed with an autoimmune disease. So I was diagnosed with lupus and several other medical issues, myocarditis, which resulted in myocardial fibrosis.
Mhm.
If anybody knows anything about lupus, it's marked by a lot of joint pain, muscle aches, fatigue. Um, I can also say that I was diagnosed with mast cell activation syndrome, chronic fatigue syndrome, just to name a few. And since that time, I've had a lot of difficulty over the years controlling my symptoms and finding my point of health and wellness. So I did seek out a functional medicine route when I was finding that mainstay medicine was not really helping me in my journey. And a functional medicine doctor that I see, she had recommended that I look into the patches. And she wasn't too familiar with them, but the science seemed appropriate to her. So when I did start researching them, I learned about the owner, Dr. David Smith, who had been in the LifeWave business for at least 20 years. So this wasn't new to the market. However, the stem cell patches have only been out the last couple of years. And when I was researching the science behind it, it made sense. I had been in the medical field for over 20 years and I knew a lot about stem cells, but not this type of technology. I knew that IV stem cells were very expensive and there was a 30% failure rate with them, and this seemed really cost effective. So I went all in and I started out with the X39 stem cell patch along with Aeon, which is their patch for inflammation.
Mhm.
I know that what I did research in the testimonies I had read online, people were getting these great results. So I wanted to know what it was all about. They do recommend that you have to stay hydrated and you need to give it a good trial, meaning that for each decade of your life, you need to use it that many months. So if you're 30 years old, you need to use it at least 3 months. If you're 50 years old, you use it at least 5 months. There are some people, and I was reading many testimonies about people who were getting instant relief of their pain or their acute issues by using the patch for one day, 1 week, a few weeks. I was getting jealous when I was reading these testimonies because that wasn't my case or my journey. And although I do have a lot of complex medical issues, I knew that I need to give it a good try and use it at least 4 to 5 months. So I'm 48 years old. I have to say that around the 5 month mark, I really started to notice some marked changes. So, just to give you an example, I was noticing I was having way better quality of sleep at night. I wasn't waking up in pain after 3 years of battling lupus. I was finally able to sleep through the night and I wasn't waking up with joint pain so uncomfortable.
Mhm.
I was feeling way more well rested during the day. I didn't have that brain fog that I had previously. I had more mental clarity, I'm noticing. Um, I can speak to as far as my pain during the day. I know that I was having a lot of joint pain, muscle aches. I'm not as limited in my range of motion.
Mhm.
Um, as far as the brain fog goes, you know, you just have trouble finding words a lot of time. The clarity isn't there. And I'm finding like as I'm having conversations, I'm not as foggy. I'm able to engage more in the social atmosphere. I noticed that I had stepped away socially because I just didn't feel I had that mental clarity to hold a conversation with people.
Mhm.
Um, and then also, I know this is might be TMI, but as far as PMS goes, I do want to tell you, you know, I'm very regular. Every 28 days, my menstrual cycle comes. But what I was noticing is I wasn't getting the breast tenderness anymore.
Mhm.
I didn't even know it was coming. I wasn't as irritable and as anxious. And for years, I would have to take Ambien for that PMS week, a couple nights during that week to get good sleep. I have not needed Ambien in several months, which is huge for me. Um, what else can I tell you? Oh, this is really important to note. So while I've been on hydroxychloroquine for my lupus for the last 3 years, although it was helping some symptoms, after a year, I had to go on immunosuppressive treatment, weekly injections for the last 2 years. And since I've been using the X39 stem cell patch, I have been off of my immunosuppressant for 5 months now, and I've been able to wean off of 4 medications, which is huge for me. I did try to wean off of medications a year ago, couldn't do it, had increased pain, inflammation. So I had to just go back on them. So I feel like the little things that maybe each day you're noticing you're doing a little bit more. Another example, I was having a lot of fine motor issues, holding a gallon of milk, going into the refrigerator and taking my fingers to just hold it and walk over to the counter and pour my son some milk. I wasn't able to do it. I was dropping things. I had that just, just the fine motor dexterity to do things and hold things. My hands were so weak. My arm pain uh, was so difficult to just even open jars or do fine motor tasks. I wasn't able to do that. I'm now noticing, oh, I just went over to the refrigerator. I got the milk out and just poured a glass, and I didn't even realize like my pain wasn't as bad. My weakness wasn't there. So I feel like these little things I'm noticing as the days go on are huge improvements for me. So I hope that gives you a little bit of an idea of what it's done for me.
Mhm.
Just the science behind it is so impressive. I think that this is amazing technology that people really need to investigate and
Yeah.
research because the benefits are amazing. And I think it's just going to be people trialing it to see what their own testimonies will be.
Right. No, I love that. And thank you so much for sharing that. That's been quite a journey, and I know it's been painful and stressful for you. And you've really have come a long way. I mean, you've gone the traditional medicine route, um, with medication and as well as, doing, other things, right? But this is something that's really helped you with the symptoms, and has given you your health back to some degree.
Yes, absolutely. I mean, I was unable to perform my job as a nurse practitioner and had to step away from the hospital arena due to my cognitive function, my
Mhm.
physical limitations, my medical problems.
Yeah,
And I feel like I'm finally making a comeback. And it's been about almost 6 months. I'm at the 6 month mark. And I feel like the strides I've made in such a short period of time, I'm excited to see what's going to happen in the long run. Where am I going to be in a year from now? So I'll
yeah,
have to do another circle back to fill you in on the progression.
totally. Yeah, no, that would be amazing. I know. I'm so excited about this because it's something that is really helping to activate your own stem cells, right? It's not a, it's not a medication, it's not a pharmaceutical, it's something that is naturally activating your own body to regenerate itself, which is what we all want to do, right?
Absolutely. I mean, it's a non-transdermal patch. You apply it to your skin, and by the heat of your body, it activates the GHK-Cu copper peptide in the patch, and that is what helps stimulate your own stem cells. And I'll
Right.
show you. It's a little patch, if you can see.
Oh yeah. Oops.
Yeah.
Yeah, I can see
They
it. Yeah.
recommend they recommend you put it on C7, which is if you tuck your chin to your chest, you can feel the bony prominence in the back of your neck,
Mhm.
and that's where you put the patch. And it's 12 hours. It's very simple. So many people can do it. You put it on in the morning, take it off at night.
Mhm.
Form of photobiomodulation, if people are familiar with that.
And do you recommend for people to do you wear it during the day or evening, like 12 hours during the day or 12 hours in the evening? Does it matter?
So it's really up to personal preference. The way that the CEO had kind of marketed it was to put it on in the morning, take it off at night. You can wear it 12 hours, but they do recommend that you take it off for a period of time so that your body has time to rest.
Okay, that's great. And then you mentioned drinking a lot of water is important and to maybe pair that with
Yes.
lights.
So in the beginning, they do talk about how some people can go through a health crisis or a health detox, which is essentially, you can experience fatigue, um, headaches, nausea. It's minimal, but there are potential that people could have these symptoms, and it's just your body's way of detoxing. So they always say, make sure you stay hydrated, use electrolytes. You can even put, they say, Celtic salt in your water is helpful too, but you just want to make sure you stay hydrated and
Right.
drink at least half of your body weight in ounces. That was the recommendation.
Perfect. Yeah. And I think that's a great recommendation for anyone anyway, right? Should be
Absolutely.
drinking that much water at least.
Hydration, hydration, hydration. Number one cause of daytime fatigue.
I know you told me that like 10 years ago, and I have these headaches, and you're like, you're probably dehydrated. How much water did you drink today versus coffee? And I'm like, my gosh, I drank so much coffee today. Not enough water, but no, that's definitely important. Well, thanks again for sharing this information. And we will have like links below to LifeWave, to the X39 patches, and to Limturi, where we will be carrying the products here. And there's so much that this company has to offer, not just the X39 patches, but their other patches, such as glutathione, which I know you have some experience with. Um, and if you wanted to share anything about the glutathione, I think that's really, we do have a lot of clients that come here asking for glutathione shots and IV. Um, and it's really great for restoring on a cellular level. So have you tried the glutathione patches?
I do. So after my vaccine injury, when I started using this patch, I was using glutathione 3 days a week. So initially I was on liposomal glutathione and I had considered IV, but they were talking about through the LifeWave glutathione patch that it elevates your levels of glutathione 300%, which I was blown away by that. So that was the reason why they only recommend you use it maybe 2 or 3 days a week.
Mhm. Okay. Yeah, no, that's great. So obviously there's a ton of information and we're gonna, like I said, put the links below. There are a lot of studies that I've looked at and read so far, and those are pretty incredible. Some of the studies that they have on these patches and you know, what's helping people, the outcomes.
The
And we,
photos are amazing when you
yeah.
see people's photographs. I mean, everything from helping, with collagen because stem cells increase our collagen production, people's skin, they have decrease in their wrinkles, everything from varicose veins, wound healing, spinal stenosis. They actually saw on x-ray somebody had used it for 2 years and it was resolved, which is virtually unheard of.
Right.
There's also been a lot of testimonies with people who have had gray hair and their hair color has come back. hair regrowth for people who are losing their hair. There's just so many areas, like the possibilities are endless when you're talking about stem cells. I mean, virtually once you turn 30, you lose 50% of your stem cells. So as we age, we're all ending up with these chronic health issues and deconditioning just as a natural part of aging. So I feel like, you could anybody could try this. It's a simple thing to do and it will improve the quality of your life. And the other thing too to keep in mind is, I was speaking about those people, which I was jealous of, who would put the patch on once and they have immediate relief of their pain. The CEO, Dr. David Schmidt, was talking about, our genes are resetting. 4,000 genes are resetting within the first few days of using the patch. So it's something to keep in mind that although you may not be feeling changes, that your cellular health is improving. And that is something that I had to keep in mind too, because I would read testimonies and say, well, it's 2 months in. How come I don't feel better? How come I don't have, virtually no pain? But,
Right.
I do have a lot of complex issues. So I think it's important to keep in mind, you might not be the one patch wonder where you put it on once and you feel great, but if you stick with it, and I'm so glad I did, because here I am 6 months out and I'm experiencing all these benefits. So as time goes on, our cells are healing. And I think it's so important to keep that in mind.
Yeah, I love that. I think that's truly like the key here is, there are so many people out there that are not feeling well and they are feeling fatigued and pain and chronic illness and they just want some relief from that and they want to feel healthy. And this is a way that, they can do it with that is non-invasive, right? It's not cost, it's obviously a cost, but it's not extremely costly like some other infusions can be. And stem cell infusions are obviously very costly and people go to other countries for them and so on and so forth. So it's something that's within reach for many people and non-invasive, pharmaceutical approach, which I think is incredible. And really, it's the only thing out there on the market right now that
Yeah.
it's patented, right?
Yes. Dr. David Schmidt has a 20-year patent on his product. I believe they're about 4 years in at this point. So he has over 150 patents, which I was blown away by. And the product is in over 82 countries, which is huge. So there's really no competition on the market. There's no other product like this. That's why I feel so many people could benefit from this type of technology. And the fact that it doesn't interfere with medications is huge because it's a non-transdermal patch.
Mhm. Yeah, this is really incredible. I think this is kind of the new venture, right, for health and wellness is to heal ourselves, and doing that through multiple modalities. But this is definitely a modality that is very, easy. It's reachable for everyone, and it really covers a multitude of symptoms and um, things that people are experiencing, and that can help them feel well. So it's exciting, but I definitely wanted to thank you for joining me today and talking about this. And we'll definitely do a recap and let's do another recap in like say a couple of weeks, and we'll check in and see how I'm doing on my patch.
Sounds great. And I'll update you on my status as time evolves as well.
That sounds great. Thanks so much,
Thank
Amy.
you.
Good to
Thanks
see
for
you.
having me.
Yeah,
You
have a good
too.
day. You too.